Good morning, good afternoon, good evening, and welcome to this podcast, which is one of a series of podcasts we're doing with leaders on the theme of ideas into action, inspiring leaders to mobilize collective solutions, which is the theme of the Global Leadership Exchange in Ottawa next year. I'm delighted to welcome Josh Wallace here today. And Josh, would you just like to introduce yourself, please?
Absolutely. I'm Joshua Wallace and identify as a person who's thriving in long-term recovery from co-occurring challenges. And I think thriving is a very pointed word in this regard. I'm also the CEO and president of Peer Washington. We are the oldest and the largest peer-led behavioral health peer service organization in the state of Washington. And in addition to serving through peer work, mental health, and addiction, we also do peer work around HIV.
Fantastic. So, do you want to expand on that work a little bit? The work that Peer Washington does.
Absolutely. I think we have kind of a unique history in that we were founded in 1984 as Seattle AIDS Support Group. And for those that remember that time, there was really nothing but fear and firebombing and so forth. And so our founders came together with a very short and indeterminate life left to live to provide support for one another, peer emotional support. And that's extremely moving to me. And while I don't think it had any relation to the mental health peer movement, a lot of the same principles were drawn from that. We were an LGBTQ and still are an LGBTQ organization, which makes a lot of sense, I think, for most people in the HIV realm. But when that changed, when the world changed in 1996 with retrovirals, we really looked at, do we have a place and a space here with this peer work? And so we began to address other issues among the LGBTQ community. We're 4 times more likely to be impacted by addiction, mental health, and particularly addiction, because that's where our community is supposed to go out and meet and be comfortable with one another. And so we began to expand our focus in that direction. And this was about the time that I joined the organization back in 2005.
Mhm.
Uh, I came into recovery in October of 2005 and joined in November and joined to be a part of their addiction recovery groups. Um, Over the years that I've worked here, and I've been working here since 2009, we've continued to expand that to encompass mental health. And to my knowledge, we're the only ones that provide peer emotional support for both behavioral health and physical health. Now, there's long been peer support around HIV and stuff, Shanti models and that sort of thing around the world. And so, not necessarily new in that regard, but I do think it's interesting that we're addressing the full breadth of healthcare in peer work, because peer work, I think, can be very powerful in a lot of stigmatized and difficult situations.
Yeah. So, what are you particularly pleased about in terms of the way peer work, where you are developing peer work?
Well, I think what I'm pleased about is I've really seen my role to be twofold. One is to be sort of a holder of the line. What really is peer work? What's not peer work? And how do we stay into our own course when this type of work has never been really defined among behavioral health. And I think within our work in the behavioral health community, everybody always wants to fit us into a box that already exists underneath counseling or something of that sort. And that's simply not what we do as peers. And so, I know change is hard, and I think really sort of bringing a new approach to behavioral health work is always going to have this sort of fight and battle. How do we fit into this process? And so for me, it's been about holding the line, making sure that we don't cross over into doing work that is not peer appropriate, while allowing the community to come forth and say, this is what we need support around. I think peer support is amazing in that, we come to it with the experience in life, but what we need to learn and what we teach our folks is how to walk with another without pushing our own agenda onto them and supporting their agency and withholding judgment, right? Because at the end of the day, we're not here to make any change. We don't hold power over an individual the way most professions would. We're simply here to say, you're not alone. I understand you, because it frees up that opportunity to talk and to have realizations in your own life. And we need only support what they want in their life without pushing our own agenda. And when you create a situation like that, you open somebody up to the safety of being able to explore and talk about what they're going through, what they want, and continue to have experiences where, should they have a fall or a success, they get to come back and talk to someone about it and really share about it and learn about it and move forward with it.
And where do you think peer work sits now in terms of the pattern of service, and where should it sit?
Well, to me, peer service, I have often tell people, while it was never formalized, I see it as the oldest form of behavioral health support in humanity's
Mm.
history, right? I mean, how many times have we talked until you walk a mile in my shoe, that sort of thing? Um, where it sits to me is it sits with both with community and also sits in the professional realm as a part of the treatment team. We don't do professional services, and professional services are extremely important. People study theory and applying approaches to addressing serious mental illness and addiction, and those are extremely important. But in those cases, you have to realize that there's a power differential there, and there's an impact when there's stigma and a power differential involved in most any situation. And I think being able to bring somebody alongside, and as we have seen in many different studies, and as we see in our own work, who says, "I understand this. I'm here to help you advocate for what you need and to simply listen to what you have to say." It helps people move along that recovery continuum much faster, because they don't feel like they're necessarily against someone or something and trying
Mm.
to find their way. They have somebody who can really relate to them. And then I say community based because these are lifelong illnesses. These things don't go away, right? When we deal with, well, most addictions, and I think mental health and serious mental illness. And so to think that we're going to address them in some uh, set term of time in a professional environment is not realistic. We need to think about, how do we continue to support ourselves afterwards, right? And how can we use these opportunities, as I see peers doing, to reinforce our own recovery, continue to challenge ourselves and our thinking about the world that we're living in, the way things are today, by simply continuing to have those conversations with those who are struggling. I know that from that is where I continue to draw my power and strength in my own recovery, because what's right for me 10 years ago is not necessarily right for me today. And I think too often people are sort of dropped off if they get done with any type of service, and life continues to move on, and they don't necessarily have the tools or the interactions that are going to create opportunity for them to learn more about themselves.
Yeah. So when you look at the kind of environment that we're working in at the moment, what are the particular challenges that you see in the current environment, or that you see coming towards us?
Well, first of all, stigma.
Hmm.
Always stigma is going to be at the very beginning. For too long, we have and continue to look at people as being broken. If you have mental health, you're broken forever. If you're an addict, you're a moral failing. And there's some relief to that in terms of recovery, meaning that you're a superhero, but only if you stay in that recovery. Um, you're not a superhero for getting into mental health recovery. And so oftentimes I see people with co-occurring disorders like myself stay in a cycle of addiction use because they don't address it. And so I think stigma and the way that we view those two things, when they are really much more connected
Mm.
than I think we wanted to realize in the past, is problematic. And then when you talk about the safety of being able to be with someone who understands what you've gone through in a stigmatized environment, it means that you're walking into places, or maybe just being amongst community, who feel like you're not a safe person to help someone because you've already been deemed as broken. Um, Broken is, I think, a kind of a rather harsh word. I think opportunities for us to address life's challenges and overcome them, that's thriving to me. And this is where we get to take that knowledge and that experience that is going to help open someone up to the opportunities of change, to show them that things are possible in a world where everybody's told them that nothing is possible for you. That's a powerful statement, and it's recovery is hard, and you're going to walk a very difficult journey and not have anybody necessarily by your side that says, "I understand it." It becomes more difficult.
Yeah. I mean, you talked about when in 1995, 96, with the change in pharmaceuticals and the change. So we had we had a new technology that changed the experience of people with HIV, and yet there are other needs that continue. I mean, how do you see the landscape now in terms of the kind of needs out there and the kind of issues that the community is facing? And how has that changed in the sort of 20 years that you've been working?
Yeah, I find this particularly interesting. Being an organization that was originally founded as an aid service organization, that transition around 1996, where we began to have less and less folks seeking out support services because now there
Mm,
was not necessarily a death sentence, there was money being, funded into research and to therapy and all of that, which is amazing. But it didn't take the problem away. And I think to me, it spoke to another piece of reality for us. So when you look at behavioral health in its totality, not necessarily just in the LGBTQ group, again, we're four times more likely to be impacted by HIV as people with behavioral health challenges. And so I think there's still a tie in there to the way that stigma
mm,
and oppression push folks towards drug use or dangerous use that oftentimes cause these things. And so what's been most interesting to me is that while there's still some folks who've been members with us for a long time who'd like to have those direct conversations around HIV, they're not happening like that. They're happening as secondary conversations, and these are extremely important conversations, but secondary conversations to addiction and mental health, largely addiction, right? Because people are they're either serial converting during that time or they're becoming med non-compliant. And so when they return to try to address this primary issue that they're struggling with, this is another whole part of the health that they need to adjust to. And it's all encompassing. And when I look at a person, when I think about peer work, I think about addressing the individual, not a part of the individual or a slice of the individual, but the entire individual, because every part of your life is an impact to your addiction, to your mental health, to your ability to be happy, to your ability to survive. And so we need to be able to have at least one container in which all aspects of your life are held, that you're able to be held as you are today. And how do we move forward today? Because when I think of therapeutic work, I think about working in the past and I think about working in like surgical, right? Whereas how are you today? And what an amazing question to be asked and to be able to answer to me has been a powerful thing about peer work.
yeah, yeah. So, what would you like to see other services doing alongside peer leaders? What I mean, I suppose there's two things, isn't there? One is what do you see a further expansion of the role of peer leaders within the context of services? And then what would you like to see other services doing?
Well, I think in terms of peer leadership, I think first of all, it's woefully misunderstood that peer leadership doesn't have a development process. Within my organization, we have 7 levels of
Mm,
supervision, right? And so I think some moving past the stigma and understanding that peers supervising peers is extremely important. In fact, peers being supervised by clinical staff to me is largely inappropriate because they're not allowed to do the very things that we're supposed to do, like relevant self-sharing. And so when they follow the hard task of things that they need to do to maintain safety, they're really kind of going against what peers are supposed to be doing. And so I think an issue here of a compromise of the integrity of peer service in the natural form and training of the individual who's overseeing it. So I think there needs to be some separation there. I think there needs to be some, and I'm seeing a huge increase in the respect of what peer services bring to the behavioral health treatment environment. So I think that's beautiful. But continuing to allow peer services to build its box within the behavioral health professional realm that says this is what's appropriate for us. This is the method by which we train, how we maintain safety, how are we going to interact with people, whether we're working alone in community or whether we're working in inpatient or outpatient. I mean, I think there are so many different opportunities, but they're guided by the same principles, and they need to be allowed to do so and to flourish that way. And I think on a larger note, to me, is that because peer services is still really early in its movement, relative to time. We don't do a whole lot of talking with one another. We work in silos. And so, there are things that I've created that are beautiful in places where I've struggled. And it's not uncommon for me to meet someone else and hear beautiful things that they have created and places they've struggled that maybe I could lend some perspective on. And this is one of the things that really excites me about what the Global Leadership Exchange is doing, because we need to get out of those silos in order for peer work to continue to grow in a way that is at least systematically similar across experiences.
So, I mean, I think you've talked very powerfully about the importance of respecting peer leadership and the different levels of skill within peer leadership, and the way in which peer leadership's developed and continuing to develop. I mean, what do you think others can learn from peer leadership? What are the sorts of things you'd like people to be learning from the peer leadership movement?
Well, I'm going to talk about a couple of things that are specific about leadership and to me specific about people who are peers.
Hmm.
So many of our folks, they may have grown up in very difficult lives, and by the time they become peer workers, it might be their first real job. And so I think there is an opportunity here where, street life and street rules, which I've had to live by, are much different than what it's like to be in a workplace. And I think being able to train folks on that and to understand their power and their limitations is extremely important. Um, I think it's also important, I think, with leadership, particularly in the peer movement, that we are we need to be able to, I want to say this. Well, oftentimes I see folks in the peer world who come to understand trauma-informed care and safe space and all of these tools that we use to create that safety for people who are in crisis will oftentimes hide behind them. If they're being, let's say they're being written up for some poor performance, then all of a sudden this is not a safe space. And I think there is a detriment to us in our work by taking that stand, because it says we're victims and we're broken, and that's not what I think we are. I think if we're in a place that we need to have safe space, then we need to receive the peer support, not give the peer support. And so some ownership and some attachment, I think, to the professionalism of this work is extremely important for
Yeah.
us, especially in supervision. And then the way that we hold folks, right? It's not, we want to make sure that they are not creating harm, that they're abiding by peer principles, but not necessarily getting into the nuance of exactly what they share or how they share. We want to provide as many tools as possible and let each individual um, be able to react to the situation, the conversation at hand.
Yeah. So where would you like to see peer leadership go next?
Well, I think for me, peer leadership, to have something that's more sustained in terms of what does the model look like, what are some of the key uh, points of leadership that are absolutely need to be there? What are some training focuses that we feel that every peer leader should have or should continue to get in continuing education? I don't think that at any time we should stop looking at building either the core work of peer or how we supervise it. I think those things go together.
Hmm.
And I think that we can carry those same principles that we have across many thresholds. If we fail to take the opportunity to look at that and to try and create some form around it, it's going to free form on its own. And what people I think will do is use what they understand are supervision methodologies from other industries that are not necessarily helpful in this regard. And we have an I think we have we really have a responsibility to those we serve and to those that we're asking to stand in the way of secondary trauma and do this work, that we create these opportunities to maintain some safety within their work and within their growth in their career.
Yeah. I mean, one of the things I suppose that has come through in a number of the podcasts is how the world has changed. And we're going through a period when we're not quite sure where we're going in terms of people, how people gather. So some of the traditional places in which people gather I know would appear to be in decline. There's more online gathering online. I mean, how is that impacting on your work, and how is that impacting on the community that you work with?
Well, yeah, when COVID hit, we really began to look into doing first online only and then later on hybrid. And there, I think, are advantages and disadvantages to that work. When people meet online, there's an ability there of anonymity to, or at least to create a certain amount of anonymity, and that anonymity can be helpful or harmful, I believe. In some cases it means that you can be quite honest. In other cases, it means that you can take action without repercussion. And so I think we need to keep an eye on that in terms of safety for individuals. Meeting in person, or in the old phrase of
Mm.
breaking bread together, really means a lot in building confidence and a correlation between individuals. Now, we're not asking that everybody necessarily do this, but that in-person thing is pretty important. But to accept that that's not possible everywhere, I think is absolutely important. We need to be able to have things for folks who live in rural communities or in communities that don't support behavioral health to be able to access some type of support. There's no reason why they should be left out to suffer on their own just
Yeah.
because of where they live. And so I think we need to embrace it and continue to embrace it and always be mindful of the potential dangers it can create for folks when we give that ability of anonymity. And I'm not saying that people need to say who they are, but you can sign on under a false name and you can begin to attack a group. And we've seen this within people and really trigger them. And that's the kind of stuff I want to avoid. And also to avoid that, if it's not something you would say to somebody in person, why are you saying it here? I think the safety of having the internet is a way that people can use to harm other folks.
Mm.
And that's what I worry about the most.
So what would where would you like to see peer leadership be, say, in 5 years, 10 years time?
I'd like to see peer leadership continue to grow as a respectable part of the behavioral health or even healthcare continuum.
Mm.
And I think in order to do that, we need to continue to be very diligent in the consistency and the discussions around what we're having and what's important, but in the consistency in the way that we roll out the methodology for peer leadership. And what does it look like? What does it mean? And how does it really serve the peer movement? And how does it serve individuals within behavioral health care?
Yeah. We did a podcast earlier in the year where we were talking to Ron Manderscheid and Laura Van Tosh, who were saying that they didn't think that we would have got some of the key principles like the recovery principle established in the United States, certainly as they were talking in the United States, without peer leaders being part of the process.
I would agree with that. And Laura Van Tosh, I've known for many years and is a force to be reckoned with. So very proud of the work that she's done, as I'm sure you're aware. But I think it has taken people who are not afraid to step up and speak out and speak loud. And I think that's true with any movement, especially movements around stigmatized information. Um, to think of the things that were done in the decades before I began doing this work, things that Laura Van Tosh was working on, made it possible for me to do what I was able to do. And so much has changed in the last 20 years since I've been doing this work. And all I can see is that there's so much more future ahead, and I think anybody who enters this work should be excited about the many opportunities that are still going to grow and open up to them in the near future. I mean, this is the place to climb and grow within your own lifetime as a part of this movement in this industry.
So, what would your advice be to someone starting out now?
My advice would be learn as much as you can, um, have as many discussions, be a part of as many advisory groups, anything that's going to help you think about this work, stretch your mind, and have your input. Be a part of the dialogue. We can't do this on a few people. We need this to be with a lot of people and be excited because this is such an amazing opportunity. There's so many things that you can do. I mean, it's not, everybody's going to be a little different, I suppose, but you can either take a job and sit back and do what is told of you, or you can recognize that this is a moment and opportunity in the history of peer work where we're really going to be setting the foundation. And to be a part of that is an amazing gift.
Josh, thank you very much indeed.
Thank you.